of lean. The third module we will be talking about the application of the lean in the healthcare industry. The fourth module will talk about the healthcare waste, and in the fifth module we will be talking about the SSA's approach in the deployment of lean in the healthcare industry. This webinar is hosted by our chairman, Mr. N.C. Narayanan, who has more than 30 years of experience in consulting, and he has driven successful lean projects. So to begin with, I would take a 10-minute session on the current state of the healthcare industry in India. Medical tourism is on rise in India. Medical tourism is one of the major external drivers for growth in the Indian healthcare sector. For example, a cardiac surgery in US costs around $50,000, while in India it costs only $4,000. India provides best-in-class treatment. In some cases, the cost of the treatment is 1/10 of the cost in US. Indian doctors and Indian hospitals excel in the field of cardiology, joint replacement, gastroenterology. So India has become a major destination for the international players for medical tourism and client studies and research programs. Indian healthcare today attracts a large number of domestic and international players. So we have companies like Max New York in life insurance coming in India for a joint venture, looking for a joint venture to provide an insurance coverage. Similarly, a joint venture between the ICICI Group and the Prudential Group, they are giving a joint plan designed specially for the diabetic patients. As the Indian healthcare industry is growing along with the Indian population, it is a large sector in revenue generation as well as providing employment to the Indian youth. Healthcare is one of the prominent contributors of the Indian GDP, which is around 5.25%. In the next decade or so, Indian healthcare industry is poised for a massive growth potential, and it can be seen in the next slide that by 2020, Indian healthcare industry would be more than $250 billion US. So that is the kind of growth that we are going to experience in the coming decade. Now what this slide speaks about, what does the Indian healthcare industry comprises about? So as you can see in the presentation, hospitals contribute to 70% of the healthcare sectors. Pharmaceuticals contributes to 13% of the healthcare sectors. Medical equipment to 9%. Medical insurance and diagnostic for 4%. And diagnostic as a sector only 3%. So we see that hospital is a very important pillar of the Indian healthcare sector, where patients go in for treatment, for right medication. Apart from the treatment, the hospital doctor also addresses the anxiety of the patient so that for an improved healthcare status. Now this slide talks about the comparison of the healthcare spend by the public and the private sector across the world. So in India, you can see that the public sector spending is 26% in the healthcare, while as the private sector spending is around 74%. So there is a huge gap between the public and the private sector healthcare spend in India. This is especially so because Indian government is not focused on the healthcare, and all the opportunities which are available in the healthcare is availed by the private sector. Vis-a-vis, if you see in US, the healthcare, public healthcare as well as private healthcare spending is nearly equal. The next slide, it talks about the comparison of the percentage of the GDP which the nation spend on the healthcare. So again, you can see. Okay. Is it? No, it's a comparison of percentage. No. Okay. So the comparison, here in this slide we are comparing the percentage of the GDPs which the nation spend on the healthcare. We see that in India only 4% of the GDP is spent on towards the healthcare, while in developed nations like US, it's 18% of the GDP is spent on healthcare. So this is the wide range in which the healthcare spend is there in both the developing as well as the developed nations. So here in this slide where we talk about the comparison of the hospital bed density, we're actually talking about the infrastructure that is available in India and developed countries like US. So you can see per 10,000 person, the hospital bed density in India is 12 as compared to 31 in US. Doctor density in India, for 10,000 people, there are 6 doctors, while in US, for per 10,000 people, we have 27 doctors. So that is the kind of infrastructure and the trained professional we have, and India needs to improve on this front. So what are actually the growth drivers for the Indian healthcare sector? First is that is the increasing patient population. I'm just waiting for the slide to change so that you can relate to the content I'm going to speak about. Okay. So what are the growth drivers for the Indian healthcare sector? One is the increase in the patient population, increase in the lifestyle related diseases. There's an increase in the quality consciousness, the quality of the care which the person is receiving. There's an increase in the disposable income. Yes, there is awareness on the preventive healthcare disorders. We have various awareness programs that are being conducted, so the people are aware of how to take care of themselves and how to deal with the diseases, affordable treatment costs, and yes, there is the growth of medical tourism. So what are the challenges which I'm waiting for the slide to change. Yeah, so what are the major challenges in the healthcare sector? One is the optimum utilization of the trained resources like our doctors and nurses for the better patient cost, minimization of the operational cost of hospital management, maximizing the performance unit is directly related to the safety of the patient. Today, our major challenges, the major challenge is in the scaling of the healthcare business. That is because of a lot of reforms that is needed to be brought in by the government. There is a problem in scaling of the infrastructure, getting trained manpower. So these are the major challenges of scaling up the healthcare business in India. And yes, there is a big challenge of providing the best quality treatment. That is the pressure of providing good quality treatment to your people. So as of today, if we say the Indian healthcare industry, we can say that we can see it as a glass which is half empty, or we can see it as a glass which is half full. There are various challenges in terms of building up the infrastructure, getting trained people. At the same time, there are compelling opportunities where we can go ahead for cost-effective clinical practices. There is medical tourism, which is developing, which is a very good opportunity for us to grow. So for all of us who are going to view the Indian healthcare sector as a glass which is half full, there is definitely a potential for us to grow. So friends, this was from us, the module 1 about the state of the healthcare industry in India. Now all the modules will be taken up by our CMD, Mr. N.C. Narayanan, whom I said that he has more than 30 years of experience in the industry and driving very successful lean deployment projects. So it's a thank you from my end, and my CMD will take over.
Good afternoon to you, ladies and gentlemen. This is a great opportunity for me. This is NC here, taking over from where Rekha has left her presentation. She has painted a picture about the current healthcare industry scenario with the statistics to create a foundation for me to take you forward on how lean can be applied in a situation like this. So I'm just making an assumption that many of you attending this webinar have got some basic idea about what is lean is all about. I would like to touch upon how this can be effectively applied in a healthcare scenario for improving the satisfaction of the customer as well as improve the profitability of the company. So the visual what you are seeing in front of you at the moment is how do we define service quality in a healthcare scenario. As Rekha rightly pointed out, we are limiting our discussion not to the pharma drug manufacturing companies. I would like to focus more on a hospital scenario where there is a major healthcare industries are focused. Now, if you want to define service quality, as you could see in this visual, on your left hand side you find safety as the starting point, effectiveness. On the right you see timeliness, efficiency, and there are two boxes at the bottom. You will notice that patient-centeredness and equity. Now, timeliness, efficiency, effectiveness, safety, etc. are equally applicable for any business model in manufacturing. But there are two things which are very unique in terms of the service quality in a healthcare scenario. The patient-centeredness, I would like to dwell a little more in this presentation. What do we really mean as patient-centeredness? And coming to the equity, here the equity refers to the credibility of the hospital over a period of time. When we go to any hospital for treatment, we get an impression that what kind of a treatment we are likely to get from the environment that we see. As Michael Harry, the founder of Six Sigma, once said when he had a heart attack, he was carried in the stretcher where one of the hospital in the US, it is written that we are achieving 4.5 sigma level in all our services. Michael, knowing the Six Sigma, he felt that 4.5 sigma is not going to guarantee that he is going to go out as one piece. So this is what his statement was. So the equity of the hospital is the function of how effectively the patients are finally perceiving about the service quality. So I would like to take you through a little bit about the lean history before we could see how lean can be applied in a healthcare scenario. As you could see that although people feel that lean came from Toyota production system, but the history shows that the concepts of lean is as old as 200 years. Primarily, ever since human beings have gone into the industrial revolution and trying to perfect the machines and try to produce them with zero defect, with the most efficient value stream, the concept of lean believed to have been in existence in different form. Although Toyota production system gave a shape to the lean, and subsequently what came from the West I would like to cover briefly as we go along. Having understood the lean basic, then we will get on to how this concept can be applied in a healthcare scenario. Now, as you could see in this visual, the basis of the products which came from the West, as motor car was invented in the US in 1906 and aircraft in 1908. The abundant resources that was available in the US economy ended up in making the gadgets with excessive material and inefficient. For example, a car may be giving 2 or 3 kilometers per liter. Ever since Japanese economy, which had a resource constraint, started thinking about making everything very efficiently. So anticipating the fuel efficiency, fuel crisis, Toyota production system came with the cars which are more economical and fuel efficient. So there is a history behind the genesis of lean, which is shifted from an abundant resource to a restricted resource scenario. So just to quickly recap what Taichi Ono believed to be the founder of lean philosophy from Toyota production system. What he has said, we are looking at the timeline from the moment customer gives us an order to the point when we collect the cash. Now it's a very simple philosophy. To the moment the patient appears in the hospital, how quickly he can be treated, and then we can convert the value creation for the healthcare industry is what is the context here. So lean is a basic philosophy. It has got nothing to do with any particular business model. Wherever there is a customer, there is a creation of value, and lean becomes applicable. Now Shigo Shingo, who is one of the supporter of lean, who has contributed for single minute exchange of die and many other concepts in the production system. As said in the next visual, what you could see, that basically we are looking at improvement. Yeah. So improvement is an unavoidable aspect of any business if it has to sustain for a long time and taking care of the perpetuity of the organization. So he has very simple way said that easier, better, faster and cheaper. These four goals appear in the order of priority. So that means if the business is dormant over a period of time, not looking at the opportunities for improvement in every aspect of the value stream, over a period of time it becomes uncompetitive, as we have seen in the Indian scenario. Those industries which were accustomed to the protected economy were not in a position to withstand the onslaught of globalization. So it is very evident that continuous improvement is a way of life. The word lean, people are curious to know who founded the word lean. Is it from Toyota production system? The answer is Toyota production system never called this methodology as lean, although they said it's a just-in-time manufacturing system. James Womack, who really brought the lean thinking across the world, has nicely represented what is lean is all about. It provides a way to do more with less human effort. You could see the key words is providing customer with exactly what they want. Now, irrespective of what may be the business model, we are trying to extract the highest resource productivity out of the investments we have made. So that is what is the essence of what James Womack is saying. So in healthcare industry, the capital investments are very high generally. So unless otherwise the resource productivity is optimum, obviously over a period of time the business model cannot be very economical. So it is not only a manufacturing industry which is producing motor car or aircraft. The healthcare industries are equally capital intensive in terms of looking at the resource productivity. Having said that, one of the mindset which I observed during the course of my consulting career, people strongly feel that lean came from manufacturing. So it is not applicable for a service scenario, particularly the healthcare kind of industry, because many of the terms and terminologies and concepts which have all come from manufacturing, like single minute exchange of die, Kanban and Pokai, okay, and so on, people generally feel that it is not applicable for their kind of a value stream. So I would like to answer this because it is very important if we are not relating the philosophy of lean for a healthcare industry value stream, probably we may not undertake these kind of initiatives to improve the efficiency of the organization. So, whenever people say that they are manufacturing confectionery, they say confectionery manufacturing is different from automobile, and if someone is making fertilizer, they feel that they are unique in their own respect. So healthcare industries are not different that way. Each one feels that their business model is unique, and then there are certain concepts cannot be applied. So I would like to deal with this myth a little bit before we could see how lean can be applied in a healthcare industry. Now let us look at in this slide what you may be seeing. How is healthcare market different from manufacturing? So the first point is, in healthcare, limiting to the hospital scenario, the presence of uncertainty. What does that really mean? If I'm making a motor car, every car can be of the same type except certain variations in color and form. But in a hospital scenario, the demand can be irregular, meaning that the next patient who is going to come to the hospital may be coming from an accident, or he could have a different kind of a disease which is not very clearly evident. So this is one aspect which is different from the healthcare industry as compared to the manufacturing. The second aspect is asymmetric information. What does that really mean is, the patient does not know what is the problem. He only knows the symptom. And the doctor, till he diagnoses the patient, may not know what treatment to start. So there is a disconnect there as compared to manufacturing. If someone wants to order for a Honda City car, he clearly gives the specification, I need a black color car, and so on and so forth. But whereas in a hospital scenario where we are focusing, the differentiation is asymmetric information, which really means that there is a diagnostic part involved in every part of the value stream. The next aspect is the different doctors may suggest different treatment. So one more complication in a healthcare scenario is the disease remaining the same. The course of treatment could be different as per the diagnosis of the doctor. So barring these three aspects of variation, healthcare value stream is almost identical to a manufacturing value stream. Another interesting aspect of the healthcare value stream is that the presence of insurance. What does this really mean? In the absence of the insurance, the economical situation of the country will decide the extent to which people are demanding the healthcare services. Now, most of the developed countries and developing countries, people have got a support from the insurance, which has significantly altered the expectation from the healthcare industry. So the demand of medical care will progressively alter, like as you could see in a developed country in the US, where the patient interests are protected to the extent of suing the doctor for very little errors. As the economy goes up in the industry, the demand for high level of service quality will be expected. So having dealt with the differentiation of the healthcare industry with respect to manufacturing, let us get into some more statistics to see what is the fate of a developing country's quality levels of healthcare. So as you could see in this particular visual, there are 16 patients die per day in a well-known hospital in Mumbai. 2,000 deaths from unnecessary surgeries being performed. 7,000 deaths from medical errors annually. Cost escalation. 60 to 80% of the cost can be reduced. That is the potential these industries have got. Work and patient flow will improve. Patient as well as non-patient care process will improve. And it will improve the morale and productivity on the bottom line of the institution. So here what we are looking at is the industry benefit point of view. It increases the efficiency, it increases the equity of the hospital, by which the perceived impression of the healthcare of the particular institution goes up, and as a social service, there are certain fatal errors which are being performed can be brought down significantly. So in summary, it is extremely important to see that healthcare industries have got huge opportunities to improve their level of services. I don't know if we calculated the sigma scale, probably the kind of figure that we are talking about may not be more than 3 to 4 sigma. That means every 1,000 patients, 3 patients will have a serious problem because of the healthcare services. So if you could see the next slide, the opportunity for healthcare industry is one is the labor productivity. So 45 to 75% scope is there to improve. These are all the figures of some of the developed country lean implementation and the resultant key performance indicator those institutions have achieved. Cost is reduced between 25 to 55%. Throughput because of the flow increased 60 to 90%. Quality of defects reduced from 50 to 90%. The inventory of the medicines and other facilities stored are 60 to 90%. Space can be reduced from 35 to 50%. Lead time for the patient turnaround can be reduced from 50 to 90%. Now, having seen that, the benchmark figures of the industries which have applied these principles in a systematic way are very significant. We see in the next visual the protected economy. On the left, when you see in a protected economy, when the cost is going up because of the inefficiency of the institution, we can add the same profit and pass it on to the customer. But when you are in a protected economy to global economy, where the customer's unwillingness to pay the price because they have got alternates, the only way we can retain the price is bringing down the cost. Interestingly, this is the game most of the manufacturing industries do play when the country is moving from a protected economy to a global economy scenario. But unfortunately, healthcare industries, where the demand to supply gaps are significant, can continue to remain at the traditional thinking that pass on the cost of inefficiency to the customer and still stay in the business for a pretty long time. Because the only industry sector which does not get very much affected during the recession is the healthcare industry. So it is very important to see as the economy grows, as it happened in the developed country, so the demand for higher level of service with the least cost could become the reality. So moving to the next visual, which shows about what are the goals that we are setting for a healthcare industry. At the top of the list is the patient safety and patient satisfaction. Coming to the other stakeholder is the employee and their satisfaction and engagement. And from the stakeholder point of view of the investors, it's moving away from a low turnover to higher productivity, and also effectively utilize the resources, which is including the number of beds and the other facilities the healthcare industries have got. So essentially we are looking at the business level KPI, which will try and improve these overall numbers so that the institution becomes more profitable. Now let us get on to how do I apply lean in a healthcare scenario. Some examples are given here based on some of the industries which have undertaken. I mean, this list is not the complete list, but it gives you some idea that one area is the laboratories, where there is the diagnostic studies are being carried out, where very expensive equipments have been invested. Then the other area is the emergency department, where the patient's care become very vital and important. And the third area could be outpatient treatment, where most of big institutions today got kind of a specialist coming and sharing the resources for dealing with the outpatient treatment. So this list could be endless. It could be carrying out the inpatient, admitted patients value stream, and many other things can be included in this. A few other areas, as you could see in the next slide, how the operating room efficiency can be improved. Such as those who would have read Michael George book on lean manufacturing in service, Lean Six Sigma in service, would have seen many case studies given where the operation theatre arrangement for one surgeon to another surgeon, when it is standardized, which brings down the cost and lead time significantly. So there are many case studies are available these days how lean has been applied in operating theatres. The other area is the pharmacies which are attached to most of the big institutions, where reducing the errors and improving the response time could be a potential opportunity. And lastly, the food services, which are very sensitive in terms of the right quality and the right time which is being served, this can be another opportunity. So there are many such value streams we can look at in a scenario where the efficiency improvement and customer satisfaction can be handled. So the next visual shows how the thinking has to move from a traditional to lean. For want of time, I'm not going to run through all of that. It gives you an idea that we are not trying to stick to the old school of thoughts, which are specific to blaming the people and getting into the root cause analysis, rewarding the individual to group sharing, and treating the supplier as an enemy at an arm's distance to collaborate with the suppliers and so on and so forth. So in other words, lean is not just a system. It is a complete shift from the mindset and culture building in the organization. So which requires its own lead time and constant interventions over a period of time. Are you doing that? So having said that, I'm just trying to give you a flavor of the various lean principles and how it can be applied in a healthcare scenario. So as you could see in this visual, there are 5 principles are there part of the lean transformation. So the first one is the value. Now let us look at what do we really mean as value. Now when we say value, every business model is intended to create a value for its customer. So the value could be in the form, in many forms. It could be in a tangible form, it can be in an intangible form. So if a person is sick and then he comes to the hospital, the value creation for him is going back healthy with all his problems cured. So the emotional level with which he is getting admitted in the hospital and when he leaves, what is kind of his emotional level for him and his kith and kin is what we are talking about value here. So customer is willing to pay for all that is happening, which creates a value for them. So what lean says is the institutions have to first of all understand what is the value that they are creating for their customers. Now unlike buying a tangible product like a motor car, in a healthcare store, there is a huge amount of emotional value creation happen in healthcare. Because the moment the person is sick, the whole family goes into the emotional crisis. So we are not merely handling a human body, but we are handling the value system which is behind the creating the comfort for the people concerned. Now if you can see in the next visual, the value is a ratio of the delivered care divided by cost. Delivered care, I would like you to notice the word care. So it is essentially the perception of the people using the healthcare services is what we are talking about, the care as the value, and the denominator obviously at what cost is available is what we are really looking at. So when we are going to look at the lean value stream in detail, we would like to look at how the numerator can be enhanced and the denominator can be made more efficient. So having said that, how do I enhance my value and reduce my cost? The lean philosophy says you need to nurture the value added activity, the activity by which the patient perceives that there is a creation of value, which is the care happening, and eliminate the non-value added activity, which essentially is not really helping for the customer to perceive a value. So there are activities which are falling in between these two categories, namely the value enabling activity, which are required for the institution, but probably the customer may not be interested. Maybe maintaining certain records for the statutory requirements and so on. So what we are talking about, value adding activities such as transforming the patient's sickness or what the customer is really looking for of a timely food of the right nurturing dietitian recommended food and so on and so forth. So what we are talking about is how to enhance the value added activity and eliminate the non-value added activity. So there are several examples are given in the subsequent slide which I am right now referring. So the value added task could be the nurse doing or the doctor preliminary examination could be a value adding activity. This example shows out of the 75 minutes the patient is spending in the hospital, only 35 minutes are the perceived value creation. So which leads to only 47% of the value creation happening out of the activities. So the moment when we are looking at the lean perspective, having defined the value and we are looking at the micro level of every activity, we will be able to assess what are the activities we are performing where we incurring cost, but it is not directly adding any value to the customer. Having said that, there could be many waste in a healthcare scenario, maybe over treatment, maybe failure to coordinate care. There could be frauds happening, the right medicine is not reaching the, as it sometimes happens in government hospitals. Their administrative procedures are very complex, where the patient goes through a lot of hassles in the administrative process, and there are a lot of rules are created in the hospital which are burdensome to the people. They feel that they need to do a lot of extra legwork for getting there. One side they are anxious about their loved ones, on the other side they are put into a lot of burdens during the transaction. So when we are truly looking at the opportunity for enhancing the quality of service, we might look at every value stream in detail. So the industries which have taken up lean implementation have found that only 31 to 34% of the time the nurse is really spending time with the patient. That means 2/3 of the time the nurse is attending to something else. Most of the patient time is spent in waiting, moving, etc. Even if you go for annual medical examination, you stay for 6 to 7 hours in the medical center, out of which the total value adding time is not more than 1 hour. So rest of the time is moving, waiting, moving, waiting, moving, waiting. So these are all something is a very big opportunity for both the parties. So 80% of the time spent in healthcare process is a waste. It may not be a good news, but that is what the reality is. So moving to the next visual, it is showing you a hospital carried out a spaghetti diagram of the patient movement and information movement. As you could see from this, the number of places one has to walk around. So when we are talking about the lean, to see the complexity of the flow, here the material doesn't flow, the patient is flowing from place to place. So this is showing you to what extent there is an opportunity for improvement. So essentially, lean is trying to enhance the value added activity where the patient care will be enhanced and eliminate those activities which are not adding any value for delivering to the customer, not to the organization, is what exactly we are looking at. So that is about the value. Let's look at what you mean by value stream. Now in simple terms, a value stream is nothing but a set of processes in the organization where the value creation happens. Now here, for example, there are three value streams are listed here. One is a patient value stream. It is something like a raw material moving in the factory to become a finished goods. A patient is moving from the outpatient to admission to till the discharge. This is one value stream. The other value stream is the medicine and the material value stream, where there are a lot of medicines are flowing down to the system. And third is the information value stream, where there are a lot of informations are collected about the patient's history and so on. So it has got its own flow. So essentially there could be three value streams as listed here in a healthcare scenario, but there could be more than three value streams if one may like to drill this down further. So a value stream, as you could see in this visual, a value stream is nothing but a set of business processes like it is shown here. Initially prevention, monitoring, diagnosis and preparation, treatment, recovery and long-term management and so on. So these are the typical high-level value stream business processes in a healthcare scenario. And as you could see here, the treatment can be further drilled down into admission, evaluation and so on and so forth. So in a lean application, one we are looking at what is the value, and then we are looking at what are the value stream where the value is created to the patient. So having said that, the next objective is to see that how we can eliminate waiting, looking at how long the patient is waiting and what reason is waiting, and how we will be able to increase the flow is what we are really looking at. And how can we move from a small batch size in case if we are clubbing number of patients and trying to address them. And many of you who have already worked on lean will know what do you mean by takt time and how the takt time can be calculated and the whole workflow can be simplified. So in other words, the methodology for application in a manufacturing as well as in a healthcare is almost identical. Having said that, let us look at what you mean by flow. So there is a flow of patient, the flow of family, flow of service providers, flow of medicine, flow of supply, flow of equipment, flow of information and so on and so forth. So essentially we are trying to smoothen the flow, and some of the industries which have applied lean in healthcare have found there are 7 major flows which are listed here. So that means essentially there can be a 7 value stream which can be created, and the value added and non-value added can be looked into. So essentially the methodology, the tools and technique, the approach of studying the flow is identical. And as you could see in this visual where the bottleneck is shown, now when you are looking at any flow, there could be one particular process which could create a bottleneck, as theory of constraint as rightly pointed out. As you could see here, surgery may be a bottleneck in a value stream, or it could be appointment can be a bottleneck. So when we are trying to balance the line and ensure that the bottlenecks are removed, thereby the service quality can be improved. So having said that, the next level of application is to create a pull system. Now the lean says that you have to go away from the push system to pull system. Unlike the value stream in the lean flow implemented in an automobile industry, majority of the industries including healthcare, the patient is being pushed from one value adding process to another. It is not a pull system. So unlike other business where the customer is outside the industry, like a motor car industry, here the patient is the customer here. So the system has to be redesigned in such a way that the customer pulls through the entire processes without waiting anywhere. That's what actually we are talking about as a pull system. So having done the value stream, flow and the pull system, now we are talking about continuous improvement as a way of life. Majority of the industries where the lean has been applied is not a one-time activity, but having applied it has got follow through perfection over a period of time. So the lean also has got the continuous improvement system being implemented as a PDCA cycle, as you could see from this visual, where the continuous improvement can be taken up for future actions. So I would request Rekha to just give you a glimpse of how SSA takes up this approach in the next 5 minutes.
Yeah, that is a question.
Yeah, there's a question. Okay, we can answer the question or we can run through this and then answer the question. How much time do you have?
Another 5 o'clock at least.
Okay, then you can run through this. Yeah.
So this is Ganesh Iyer here. I am one of the directors here at SSA Business Solutions. I have a background in chemical engineering, spent time with IT and then process improvements in pharma and related organizations. So to talk about lean in healthcare and what is SSA's approach for driving it. So when we talk about the key drivers for the hospital, the profitable caring hospital, the first aspect of it is patient safety, which means that defect-free healthcare quality, timely service, revenue growth, and people. And lastly, how do you look at the internal efficiencies of running the organization in terms of the operating margins? So these become the key drivers which we are going to look at and look at how we can address each of these. So if we see the US standard is the current rate is being 1.46 is what the current medication error has been reduced to, and that is what we are trying to achieve in terms of when we look at the perfection which we are looking for. So when we take up any assignment, the first thing which we do is study the existing organization in terms of doing the diagnostic study, and then identify the diagnostic study is a means for us to identify all the opportunities in the different areas of the running the organization. Look at all the different value chains which are happening in that particular organization, whichever may be the healthcare provider, be it a hospital or a assessment lab. Then we will consider what are the key value chains which are happening. Once those value chains are identified, we look at how the customer touch points are happening. Typically the touch point becomes the interface, becomes the most critical aspect in any healthcare organizations. more so in hospitals and in even in general medical labs or other things where people go for their general checkups. Typically, what has been observed in India is that there are huge wait times. So these touch points, and understanding the customer needs become the critical aspect over here. Once those are identified, these would be evaluated and converted into the quality requirements of the internal organization so that the performance metrics can be assigned for those internal processes. And once those metrics are identified in terms of the quality, the whole improvement project is designed and the whole process is taken through our RMAOR approach, where the project is first defined in terms of recognizing the project, doing the current state value stream mapping in terms of seeing how the process is, how much time it's taking, what is the efficiency of the process, how many resources are required. Then analyzing for the root causes of those problems, looking at all the patient data, looking at the flow data in terms of how many patient inflows happen, what is the weekend flow or the or a holiday flow, and trying to see where those causes are attributed to. In the optimized phase, we talk about how we can resolve those problems and design a new system in which all the flows can be smoothened and everything comes to the place as required when it is required. And once the new system has been designed, piloted, the last step is to make sure that that is consistent, and how do we control that process to make sure of any future disturbances, flow disturbances which happen, how to take care of those. So create a whole risk management and assessment plan. So that's the repeatable part of creating this whole approach. So in terms of the deliverables, the first thing is enrolling senior management for the supporting processes and management system and continuous improvement, so that it is generally and should be, whenever a change management initiative is undertaken, it's a top-down initiative. So once the senior management is enrolled in this, then we do the diagnosis and the key process identification contributing to the problem areas, identifying the metrics and how this can be translated in terms of ROI for the organization. That becomes the next step. And last, involvement of and creating of these teams which will do systematic problem solving and create this whole engine of driving the improvement. So the whole solution generation will be joint effort, where we come in with a process angle, and some of the domain specific and related activities will be given by a team of people who have been identified for solving the project from your end. And it will be jointly done where we understand how it will be designed from a process point of view, and you would be able to contribute from a domain angle how the same thing, how the equipment should be aligned and set up. That way jointly the team is working for. And finally the review ends during the implementation audit. Those become the way in which we deliver a particular project. So in terms of the key differentiators or how we add value to your organization, one, SSA has since its inception has strongly believed in knowledge transfer, which means that we would set up a core team at your organization which would fully understand this process methodology of how to do continuous improvement. Second one is focus on business results, which means the ROI is delivered in all our engagements. Within a span of 1 year, the minimum return on investment has been 3 times. And lastly is we take ownership of the project, which means that ensuring that not just putting a change report which has to be done, but actually going and implementing the changes that are required to deliver the return on investment. So it's very much outcome based in terms of our model. Of late, we have been a lot of organizations which we have been working with are working on a profit sharing model, and our experience in different sectors also helps us when we deal with different functions and departments within the healthcare organization itself. So there might be a logistic issue or a finance issue. Those things get handled very easily because of our wide experience in all the different sectors. So that is all I had from my hand here. Thank you very much. I'd like to now have anybody has any questions.
How do you quantify care in the formula tracking is equal to deliver care upon cost?
Okay, what's his name?
Manish.
Thank you, Mr. Manish, for asking a wonderful question. How do we measure the ratio between the delivered care to cost? Now, as far as the numerator is concerned, the only way we can measure is based on the perception of the customer. In this case, is the patient. So, most of the business excellence models talk heavily on the ultimate perception is a true data. So, the API of this kind, where we are saying that whether I felt that I was cared or not, to give an example, if you are traveling by government-owned airline versus probably a private airline, we see the difference in many aspects of the service delivery, which gives you a feeling that you are being cared. So ultimately it is only a perception, but the perception is created by the process. So when we come to know the various attributes, suppose if I travel by the airline and my baggage is delivered on time without any damage, and I can conveniently board the plane and I get the food preference and whatnot. So when all these attributes are being met, at the end of the day, I feel that I was cared. Yeah. So what is most important here is to discover a metric by which we evaluate what is the perception of the customer, and then what are the attributes went wrong in creating a wrong perception in case if it is so, and then keep on looking into the process of improvement. Suppose if I am checking in a hotel after traveling overnight flight and they say that I will have to wait for 2 hours, then obviously I feel that I am not cared. So these sort of KPIs are difficult to discover and institutionalize, but they are possible. Yeah. Yeah. If anyone else have got a question, if you have not sent it, you can ask me right now. If anyone would like to ask me a question, please, we have a few more minutes to go. One more question. Yeah.
Dr. Ravi Singh.
Don't you think that Apollo crossing medication error over USA standard is little not believable, as the error reporting is voluntary, and in Indian scenario it is also so less it can't be compared. Dr. Ravi Singh, thank you very much, doctor, for asking a very intricate and difficult question to handle. Of course, we are going by the integrity of the institution to declare, I don't know, the publicly available data to what extent to truly represent the real scenario. So we have no access to any data to comment on a particular condition, but subjectively evaluating that situations are far from satisfactory and require a long way to go, even maybe in established institutions in India and abroad.
If you want.
So, is anyone else? Yes, anyone would like to ask a question, please? I could hear you if you want to ask a question.
Hello, Mr. Narayan, it's Dr. Ravi.
Yes, doctor.
When we are saying, see, these voluntary data are always a problem because I have worked for a corporate and I know over 1,000 beds we had only reporting was less than one a month, which is unbelievable. It doesn't happen. Hello?
हाँ डॉक्टर साहब हेलो
Yeah. Some of these data are so sensitive and in terms of the besides the the equity point of view what I mentioned in the lecture. What is more important is the institution knows the level of achievement is concerned. So irrespective of whether it is claimed, I think it is for the institution to know where the process capabilities are and continue to improve them. So like for example, Toyota declared that there is a problem in the braking system and they want to voluntarily replace the the components, etc. So we are trusting them that this is not a gimmick and it is more to the genuine customer care they have, although there are not many accidents have happened.
इंडस्ट्री अलग है तो नहीं समझा हेलो हेलो मैं आपको थोड़ी देर फोन करूं मैं थोड़ी देर फोन करता हूं आपको मैं कुछ देर
Anyone else would like to ask a question? If there are no questions, I would suggest that we conclude the webinar. Thank you very much for those who have participated, and it's our pleasure having you on board for this webinar. Thank you very much for your valuable time.